History-wise, CHOC has been around for a very, very long time. And over those years, CHOC has experienced a lot of growth. We are definitely heavily focused on what we call a signature and living by that signature, which is really to provide, great customer service, value, excellence to our customers every day. The problem we had was varying coverage of cellular services throughout the facility. So the driver was to bring better coverage, better service to those locations, all based on the feedback we were receiving from our end users. Our clinicians have become more and more reliant on their cellular devices as part of the clinical care workflows. Folks were starting to receive their lab results and other clinical notifications. They were starting to use our mobile app for EMR access and things along those lines. And obviously the cellular service was a key component of being able to provide those services. We had done an RFP a few years ago, originally looking at a DAS system, so a distributed antenna system. We worked with a few vendors, looked at some pricing, and looked at the infrastructure and the architecture. And we realized at the time that although it was something we wanted to do and something that we thought would add value, from a cost perspective, from an implementation perspective, and impact to the organization from an installation perspective, it didn't seem right for us. The deciding factor was knowing that we could leverage the Wilson Electronics components to be able to distribute multiple carriers throughout the hospital in a single central way, compared to having to do it with a traditional DAS system where we would have to bring in additional equipment for each of those providers and maintain that equipment separately. Leveraging Wilson Electronics, in a way, it being a one-stop shop to bring those signals in, and then on top of that, leveraging WP to do the installation, seemed to be like the perfect fit. The boosters have been on for roughly about 3 months now. Before, we were getting still some feedback from folks that things were not working in certain areas. The after really kind of turned into, hey, I noticed I could do this now in this location. People have realized, hey, wait, now I'm getting text messages at my desk when I didn't get those before. And I think folks in the organization over time became used to the fact that it wasn't going to be working in certain areas. So when we finally turned on the system and they were able to get that service, they took notice to it. The Wilson Electronics system gives us the ability to be as flexible as we can throughout the facility. Without this technology, I would really be stuck right now going more of the traditional route, which is more expensive operationally, not just the cost of the equipment, but also more complex, harder to manage, and it forces me to start working with multiple providers. With the Wilson Electronics system, it kind of centralizes everything for me. I have the ability to work with them directly. I have the ability to work with WP directly for the installation, and it gives me one partner to really standardize on. I think we've made our customers happy, that being the patient. I think we've made our associates happy, the clinicians. I definitely think we've seen a difference, and I'm really happy with the way it turned out.